Good afternoon, and thank you for joining us for this afternoon's virtual media briefing about COVID-19 in London and Middlesex County. We're glad you could be with us. Also glad to be joined this afternoon by our regular panel, but an expanded panel today as well. We are joined by London Mayor Ed Holder, the Warden of Middlesex County, Cathy Burghardt-Jesson, the Chief Medical Officer at London Health Sciences Centre, Dr. Adam Dukelow, the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackey, and the Middlesex-London Health Unit's Associate Medical Officer of Health, Dr. Alex Summers. Welcome to the media joining us as well. And a reminder, if you have not yet submitted your question, and many of you already have, just click on the question text bubble here in Microsoft Teams. And if you could indicate your name, your media outlet, and who your question is directed to. And finally, a welcome to those tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio, AM 980 CFPL, and those who are watching us this afternoon on the CTV London website. Let's get to the opening remarks right away, and we'll start with Mayor Ed Holder. Mayor Holder.
Well, thank you, Danny. Good afternoon, everyone. I'd like to start by wishing Ramadan Mubarak to all my Muslim friends in London, Middlesex, and beyond. Happy fasting to all who celebrate, and please accept my sincere wishes for peace, prosperity, and happiness, something we could all use a little bit more. Over the weekend, we recorded our highest ever single day case count. It's just our latest in a series of recent reminders that these variants are exceptionally serious and should be treated as such by everyone, regardless of age. And at the same time, though, we have several more reasons for increased optimism in our collective efforts to bring this virus to heel. First, as of yesterday, we have now administered over 107,000 doses of COVID vaccine across the region. I'd like to thank all of those who are working with such dedication and kindness at our vaccination clinics, and thanks to you who are rolling up your sleeves to receive the shot. Secondly, just a short time ago, the health unit announced starting tomorrow morning, vaccine eligibility in London, Middlesex, Oxford, and Elgin counties will expand to anyone born in 1961 or earlier. You'll remember it was less than 7 days ago we moved to 65 plus. 7 days prior to that, it was 70 plus. We're making important progress in London, Middlesex, and that progress will only accelerate. Over the weekend, we received confirmation from the province that the number of pharmacies in our region offering that AstraZeneca vaccine to those 55 and older would jump from just 2 to 45 starting today. As many of you know, this is something I discussed directly with Premier Ford immediately after it became apparent that London's supply of vaccine was disproportionate to our population size, as well as that which was being received by other communities. I appreciated that this was remedied by the Premier in only a few days, and would like to make clear to anyone who may doubt my resolve, my steadfast and relentless commitment to the people of this region and our city. You know, in politics, oftentimes you can either make a scene or you can make a difference. I will always choose to make a difference. That has been my approach during my time in public office, and it will always remain so. This is about results. That's what matters, and that's what Londoners care about, and that's what I'm fiercely committed to delivering. Don't mistake diplomacy and measured commentary with someone who isn't fighting like hell to make sure London and the region at large gets its fair share on all matters of substance. Over to you, Warden.
Well, thank you for those words, Mayor Ed, and it's great to be with everybody this afternoon. Certainly the numbers over the weekend were alarming. However, as it has been confirmed over the last few weeks, we are in a third wave, and we should be prepared for these fluctuations. I encourage all of you to stick to the protocols in front of us. Please, please, please keep your bubble tight and adhere to the stay-at-home orders, going out only for essential trips. While I am not a doctor or a scientist, what I have learned is these variant cases seem to be prone to more community spread. So please do not take these provincial orders lightly. Respect your community, and let's get through this. It was welcome news over the weekend to learn of the province's expansion of vaccines through pharmacies in Middlesex-London. The expansion of this program will allow for more accessibility in our communities. For the most part, all of our communities in Middlesex County now have access to a vaccine for residents over 55. Please contact your local pharmacy for those details. I was also pleased to see that vaccines administered through the mass vaccine clinics in Middlesex-London will now be opened to those 60 and over in our region. So please, when you are allowed to do so, make your appointment and get your vaccine. I'd also like to let everyone know that the Women's Caucus of Middlesex County is hosting another virtual event this Wednesday evening. As we are well aware, it is important to check in with friends, neighbors, and family during this time. So we are hosting another How Are You Doing event, and we will be joined by the Women's Rural Resource Center in Strathroy, as well as representatives from the OPP and the Strathroy Care Police. Our focus will be on supports that exist in our community to support those struggling with mental health issues, gender-based and domestic violence concerns. You can find registration details through my social media or Kelly Elliott's, the Deputy Mayor of Thames Centre. We want to hear how you are doing and find ways to support you during these challenging times and connect you with peers and community supports out there. Please consider joining us for what promises to be an informative and supportive evening. Over to you, Dr. Mackey.
Thanks very much, Madam Warden. So the Mayor and the Warden have spoken to some of the absolute key points already at this point. We have had our highest ever daily case count over the weekend. The numbers have come down a bit since then, but still over 100 cases today. And really important to let everyone know who is in the 60 to 64 age category, the bookings will open up at 8 a.m. tomorrow. We really appreciate the support of the media and everyone in getting that message to those age 60 to 64 that bookings will open at 8 a.m. tomorrow. Along that lines, we've also opened up a 4th week of booking. We've been booking out 3 weeks now, 4, to allow more spaces so that everyone in that over 60 category and book an appointment as soon as possible. Along with the highest ever case counts, we've also reached a point where the response within the Middlesex-London Health Unit to the cases that are being reported has to change. We're no longer able to follow up in detail with every case. We are notifying cases to make sure that they are aware of their diagnosis and know how they should handle themselves. But that next step of contact tracing is something that we can't do fully at this point. We're having to prioritize in those highest risk cases and rely on the cases to do some of that follow-up with their contacts themselves. Dr. Summers is on the line today. I'm technically on vacation this week, so he's graciously been covering over the weekend and this week, and he'll have a bit more information about all of that. You also saw over the weekend reported that about 2 weeks ago, the week up to April 3rd, the highest rate of COVID in any community in Ontario was the N6A postal code around the university here in London. That's the forward sortation area, 3-digit postal code area, and the percent positivity there was 28.9. That was about 2 weeks ago when we were raising the alarm bells. We now have that data. Percent positivity doesn't come out every day, so there is a delay in obtaining that data. But quite concerning to see the highest rate hotspot in Ontario being right here in London. The silver lining, of course, is that we are seeing more vaccines and more options for vaccines. I'm really excited to see the number of vaccines opening up across London and Middlesex over the next week or so in pharmacies. That really will make a difference in terms of making sure that people can get vaccine closer to home. The pharmacies still will have a relatively low flow of vaccine, so the mass clinics still have the bulk of the supply, but it will make it a lot easier for those who have difficulty getting into the mass clinics or choose to seek vaccine closer to home. With that, I'm going to pass to Dr. Dukelow.
Thank you very much, Dr. Mackey, Mr. Mayor, Madam Warden. Thank you for media partners and community for joining today's briefing. I wish I was here to share a more positive picture from the hospital's perspective, but the current situation across the province remains incredibly challenging for all of us. This morning, our hospital numbers, as of 3 p.m. yesterday, were reported as 48 COVID-19 inpatients, 18 of which are in critical care. As of a couple hours ago, that number has climbed from 48 to 53 COVID-19 inpatients, 20 of which are in critical care, and we anticipate that we will continue to see hospitalizations rise over the course of this and next week. Over the past week, we've admitted a total of 52 COVID-19 patients, and only 7 were transfers from out of region. The bulk of the cases we are reporting are from within our local community, unfortunately. We are also continuing to see younger patients that require a high level of care, as the average age of the London Middlesex patients that were admitted this last week was 54. Last Friday, I had the opportunity to speak with many of you about Thursday's instruction from Ontario Health to ramp down surgeries and non-urgent activities as of today. Canceling surgeries is absolutely not something we ever want to have to do. This is being done to preserve critical care and health human resources capacity as increasing case counts and widespread community transmission continues across many parts of our province. We are having to redeploy operating room team members to open up additional ICU beds. We have also converted some inpatient beds that are traditionally used for surgical patients to beds for medical patients, such as those with COVID-19. We are reducing our adult surgical care activity as the evolving situation requires. Any patient whose appointment or procedure is impacted by these reductions will receive direct communication from their care team prior to the scheduled visit. As many of you know, the province enacted a couple of temporary emergency management directives over the weekend to allow hospitals to expedite the redeployment of staff between hospitals and the transfer of patients between hospitals to ensure patient care needs continue to be met across the entire province and health system. We are working with our partners in Ontario Health West, regional partners such as St. Joseph's, to determine what this will mean for the Southwest and how we'll work together to ensure the hospital system and all patients that require care receive it. I recognize that it is easy to be disheartened by the current numbers and the situation that our hospitals are in right now, and to think that the stay-at-home order isn't working. However, in these tough moments, we need to remember there is about a 2-week delay in seeing the trend begin to shift from when a stay-at-home order is issued and from when new cases start to show up in hospitals. If we continue to remain diligent and follow the order and public health guidance, we should begin to see the benefits of our collective efforts reflected in our daily case counts and hospitalization numbers in the coming week or so. Please don't let this upcoming week discourage you from doing all that you can do to prevent the spread of COVID-19 in our community. Lastly, when it's available to you, please get your vaccine. Thank you again for having me, and I look forward to your questions.
And just before we move on to those questions, let's turn it over to Dr. Alex Summers.
Thank you, Dan, and to the Warden, the Mayor, Dr. Dukelow, and Dr. Mackey. Just a few additional updates in addition to what Dr. Mackey was commenting on. We certainly have seen increased COVID-19 activity over the weekend. The variant is now a variant of concern, is the predominant strain within our region. We are continuing to follow a number of outbreaks. Transmission is being driven predominantly through social clusters as well as congregate settings, particularly some university residents, which numbers I'll share with you now, as well as workplace outbreaks that we are monitoring closely. On the university residents perspective, we are reporting 7 cases at King's Commons, 9 cases at Perth Hall, 8 at Essex, 16 at Delaware, 10 at Elgin, 27 at Medway Sydenham, 44 confirmed cases at Saugeen, and 17 at Ontario. And those are total cases. Not all, of course, have accumulated over the weekend, but over the course of those outbreaks having been declared. Building off of both what Dr. Mackey, Dr. Dukelow, Mr. Mayor, and Madame Warden have stated, the stay-at-home order will have now been in effect still less than a week. And as we've seen from previous experiences, we will need at least 2 weeks in order to see an impact on our numbers. And therefore, we anticipate that over the next week, we will continue to have high numbers. As a result of those high numbers, the health unit has had to modify its case and contact management strategy to ensure that we are notifying all cases and doing a robust but quick investigation as soon as possible. For low-risk cases, those that are not working or living in congregate settings or in high-risk workplaces or educational contexts, we are asking cases to assist us in notifying their close contacts of their exposure and providing directions on how to quarantine. If you do receive such a letter, it is critical that you follow it and quarantine, and of course, you can call the health unit for any questions that you might have. We continue to, however, to do in-depth investigations regarding acquisition and exposure in high-risk settings, including congregate care settings, as well as riskier workplaces where people are in close contact, and educational settings as well. Thanks so much, and back to you, Dan.
Thank you, Dr. Summers, Dr. Mackey, Dr. Dukelow, Mayor Holder, and Warden Burghardt-Jesson. We've got a lot of questions. We're up to 20, so let's get into it right away. First question is for Dr. Dukelow. It comes to us from Steve Young at News Talk 1290, CJBK, and CTV London. Dr. Dukelow, what steps are being taken for additional ICU patients, and you touched on that a bit, and how many more are expected? And a follow-up question, will doctors from other disciplines be brought in to help staff ICUs, critical care? Are there any plans to commission the field hospital at Western Fair District, which is now serving as a vaccination clinic?
Thank you, Dan and Steve. You packed a lot of questions into that one, so I'll do my best to make sure I hit all the high points, but happy to have follow-up conversation as well. So the additional steps are really opening ICU beds. So areas of the hospital, such as post-anesthetic care unit, is being converted or has been converted in some situations to ICU beds. And in order to do that, as you touched on, we have to redeploy staff. So we take staff that would normally have worked in the operating room or the perioperative area, and we ask them to work as ICU staff, whether that's nurses or respiratory therapists and otherwise. You asked specifically about doctors. So we've had a redeployment plan for our physicians in the works since early in the pandemic. We do have quite a large faculty of critical care physicians. We're lucky in London. We have a large group of excellent critical care docs that can back each other up. So for now, that group is intact, and they are staffing the beds themselves for now, but we have plans to back them up if needed. You touched on the field hospital as well. The field hospital is very well developed. The media has seen pictures and had tours of that area, both as a field hospital on the one side of the building and as a vaccination center on the other. In terms of activating the field hospital, there are still a few items that would need to be put in place to care for patients there. And it would also impact the operations of the vaccine center to some extent, because over time, as the vaccine center has grown, some of the operations have drifted into the area that was previously the field hospital. So for now, we're focusing on our traditional beds. Reducing surgery, as I mentioned, opens up bed for medical patients. We also have areas of the hospital proper that used to be used for inpatient care that are now clinics that we have identified to be converted back to inpatient wards if needed without activating the field hospital. I'll also stress that we're acting as a region or a health system. So St. Joe's thankfully has opened up additional surge space and is allowing us to transfer some less acutely ill patients over to St. Joe's. And we're balancing load throughout the region by transferring patients between hospitals that have a little more capacity than we do. I think I've hit all the parts of the question, but as I said, happy to have a follow-up conversation.
And I think you got all of them there, Dr. Dukelow. So let's move to the next question. Dr. Summers, this one is going to be for you, and again, it's from Steve Young at CTV and CJBK. Dr. Summers, how concerned are you when you see case counts exceeding 4,000 for the province over the last few days?
Numbers like 4,000 per day at the provincial level or 160 at the local level are exceptionally concerning. And we see those numbers reflected in the experience of our acute care partners at London Health Sciences Centre, as articulated by Dr. Dukelow. What we are seeing is the results of ongoing viral transmission within our community through social environments, through close congregate work environments and close congregate living environments as well. Our concern, of course, is that these numbers will continue to rise if we do not adhere and follow the stay-at-home order. As a community, we've seen amazing commitment to following those orders when required, and I anticipate no difference here. We will continue to see cases likely rise or at least remain high for the next week at least. We need to give that stay-at-home order time, but we need to go as quickly as we can. For those who have yet to cancel plans, please do so now. It is no longer a possibility for us to skirt the rules if we want our system to remain intact, that we're able to provide the healthcare that we want, and that we can get through this so that we can get the vaccine into enough arms so that the summer looks like the way we want it to. So those numbers are very concerning, and it was certainly sobering, as have been the last number of weeks, to see those numbers continue to rise.
Thank you, Dr. Summers. Follow-up question for you from Steve Young. Dr. Summers, provincial data indicates the postal code FSAN6A has the highest percentage of positive COVID-19 tests in Ontario. Is that area more infected, or are people seeking out tests more in that region than in others? And a related question, we'll loop it in here, from Jennifer Beeman, and she has the same question: what accounts for the high number or the high positivity in the N6A postal code?
Thanks for those questions. The N6A postal code does capture much of the Western University area as well as the surrounding neighborhoods. The high percent positivity was specifically for the weeks through the end of March into the beginning of April, where we also knew that we were seeing highest case counts amongst those aged 18 to 22. We have had pronounced activity amongst that age bracket, as identified as well in those large resident outbreaks associated with the university campus. You would have heard me list Saugeen Maitland having 44 confirmed cases. We know that that population has also pursued testing. They are playing their part to the best that they are able, and certainly to see that postal code with such high percent positivity is consistent with where we have seen cases, particularly over the last 2 to 3 weeks. As mentioned, community transmission, though, is not solely contained to those age 18 to 22. It is people of an average age of 54, as Dr. Dukelow mentioned, that are being admitted to hospital, and transmission of COVID is happening well beyond the bounds of our university and well beyond just that 18 to 22 cohort. COVID-19 has affected us all and will continue to affect us all. Just because you don't live, work, or go anywhere near that postal code does not mean that you're off the hook from the stay-at-home order. It is absolutely critical that as a community, each and every single one of us, regardless of where we live, what we do, who we are, adhere to those orders so that we can do our part for those who aren't able to stay at home so easily. Thanks, Dan.
Thank you, Dr. Summers. Next question is for Dr. Dukelow. It's from Jennifer Beeman, excuse me, at the London Free Press. Dr. Dukelow, how many of the 48 COVID-19 inpatients are out-of-town transfers, and how many of the 18 patients in the ICU are out-of-town transfers?
Thanks very much, Jen. The total number of patients that are out-of-town transfers currently are 7, and I believe all of them either started in the ICU or are in the ICU currently. So to date, we have not, although this will change later today, taken any non-ICU patients from out of region.
Thank you very much. Follow-up question from Jennifer Beeman. Has LHSC ever had this many COVID-19 patients in its ICU at one time?
No, unfortunately, well, I guess in some ways fortunately, but no, we have not. Our highest number to date was 15. I believe that was in the second week of January. So hitting 19 or 20 today is the highest number we've had throughout the pandemic.
Next question comes to us from Heather Rivers at the London Free Press. Dr. Summers, I think this one is going to be for you. Can you give us an update? And I know you talked about the case numbers in the outbreaks at Western University. Heather is asking, can you give us an update on what is going on as far as how the cases and outbreaks are being managed? Have some students returned home?
Thanks for that question, Heather. We continue as a health unit to work closely with our partners at Western. For those who are living in residence settings, any close contacts have been moved to isolation. Many of those students are now returning home. The semester has formally ended. As you know, the university moved to remote learning over a week ago, and we're now into exam season, and much of that can be done remotely. Many students are returning home. That will certainly make a difference with regards to the risk of transmission within residents, and we follow those cases closely. We also saw some substantial numbers from social gatherings related both to non-post-secondary students as well as to post-secondary students, and our hope is that the stay-at-home order will play a major role in disrupting further transmission moving forward.
Thank you, Dr. Summers. And I just want to be aware of the time. It is 2:25, and we do have a lot of questions left in the queue. So I'm just going to look at our panel this afternoon just to see if we're good to continue along. All right, here we go then. Next question, Mayor Holder, this one is for you. It's from Andrew Graham at Global News Radio, AM 980 CFPL. Mayor Holder, have you received an update from the Premier as to whether a London postal code will be designated a hotspot?
Well, thanks for the question, Andrew. Look, these conversations continue now. My thoughts have always been clear in that I believed, as I said last week, that without question, London is a hotspot. But my own perspective is not as critical as the issues of this being a matter of science. And I know that this is something that the health unit is pressing at their end at that level, while I look to see what we're able to do at the political level. So all I can say at this time is that those conversations are ongoing.
Thank you very much, Mr. Mayor. Next question, Dr. Summers, is for you. It's from Sophia Rodriguez at CBC London. Dr. Summers, we heard that the vaccination clinic at the North London Optimist Community Centre has been very busy today. Why is that?
Thanks for that question, Sophia. The busy times at the North London Optimist Centre are by design. We have scheduled what we call stress test days at each of our mass vaccination clinic sites in order to make sure that we've got all our systems fine-tuned and running. Earlier this month, we maxed out the throughput at Mount Bridges. We maxed out the throughput at the Agriplex, and today we are maxing out the throughput at the North London Optimist Centre. As we've stated before, at baseline, because of the inventory that we have, we are not operating at full capacity at any of our mass vaccination clinics. However, we wanted to take advantage of this lack of capacity or lack of utilization of full capacity to stress those things out, to make sure that we've got everything fine-tuned so that when the inventory does arrive, we can run on all cylinders at all of our mass vaccination clinic sites. So that's what's happening today. We're running over 2,000 people today through the North London Optimist Centre in order to ensure that that clinic can run at full capacity, full time, whenever the inventory allows us to do so.
So there is the explanation for all the activity today at the North London Optimist Community Centre. Thank you for that. Another question, Dr. Summers, for you from Sophia, and this gets into particular situations in vaccine eligibility. Dr. Summers, the health unit website says cancer patients in treatment don't have to wait for a second vaccine dose. We've interviewed a woman who's been unable to schedule her second shot. She says local pharmacies won't give her an appointment because she's had an initial shot and she can't get through to the health unit on the phone. She's younger than the current cohort being vaccinated. How would you advise this woman whose oncologist wants her to get the second dose before starting chemotherapy? Also, are pharmacists and the vaccine booking service operators aware of the exemptions to the standard wait for a second dose?
Thanks for that question, Sophia. As you're aware, a majority of individuals are not eligible for a shortened second dose interval. Majority of people in this province will receive at this time their second dose of vaccine 112 days after they receive their first dose. There are a small number of exceptions to that, including people who have a hematologic cancer or a non-hematologic malignant solid tumor who are currently undergoing treatment with chemotherapy, who are able to receive their vaccine at a shorter interval. The reason for that is that it is anticipated that they won't mount as robust an immune response to a single dose of vaccine. For those who are eligible, we are able to schedule your second dose appointment at that shorter interval. When you leave your first dose appointment, or if you've already received your first dose, through calling the COVID-19 booking line, the operators are certainly aware of the exceptions that are permitted and will schedule you appropriately. I can't speak on behalf of the pharmacists, of course, but I certainly can say that for the mass vaccination clinic, those operators are aware and will reschedule as appropriate. Of course, I would anticipate that tomorrow those phone lines will be very busy as we move to the 60+ cohort, but there are certainly other opportunities throughout the week and throughout the day where those phone lines are absolutely available to modify appointments in those rare instances where people are eligible.
Thank you very much, Dr. Summers. And Sophia, the phone number for reaching the booking folks is 226-289-3560, 226-289-3560. On to the next question, and this one again, Dr. Summers, is for you, and it's from Andrew Graham at Global News Radio. Last week, Dr. Mackey said there was no need to close local schools, adding that transmission in schools is, quote, exceedingly rare in our area. Do you think schools should transition to remote learning after the April break? Why or why not?
Thanks for that question, Andrew. We continue to see, relative to our case numbers, only a small number of our total cases that we believe are the result of transmission within school. We've seen very little transmission from students to teachers, for example. We've seen very little relative transmission between students within the school environment as well. As case numbers increase across our community, we of course anticipate there will be more school-associated cases. And when we say school-associated cases, this means that a case, either a staff or a student, will have been at school while infectious. We're fortunate. Many of the precautions that have been put in place in learning environments have been very effective at disrupting transmission. However, any in-person environment will of course be a higher risk environment than a non-in-person environment, such as being at home, and that's why we see the stay-at-home order in effect. But as always, as stated by many across this province, the objective was for schools to be the very last to close, because schools are so critical for the health and well-being of our children and students within those age brackets of 4 to 17. So we will continue to monitor the numbers this week. We will continue to work with the province, and we will continue to respond to the science and the evidence that emerges before us. At the end of the day, of course, we want to ensure that students are safe, both from COVID, but also from the risks of not being in school and what it means to not have an in-person learning environment. And we will certainly hear more from the province, I'm sure, as the numbers unfold over this next week. It is important that the stay-at-home order for everything else has an opportunity to make a difference before closures of schools is explored. And again, we continue to follow up with school-associated cases to do acquisition assessments and to ensure that contacts are quarantined adequately.
Thank you very much, Dr. Summers. Let's move on to the next question. It's again from Andrew Graham at Global News Radio. This one is actually the next couple are for Dr. Dukelow. Dr. Dukelow, do you know the exact number of surgeries and procedures being postponed starting today?
Thanks very much, Andrew. I don't have an exact number of cases per se. Our activity is down about 30% at both University Hospital and Victoria Hospital at the beginning of the week. And as you can appreciate, it's an evolving situation based on staffing needs. And there was lots of work that took place Friday and over the weekend to essentially do that and bring it down by about 30%. But I don't have an exact number of cases for you. Apologies.
And the follow-up question, Dr. Dukelow, can you discuss the process for redeploying staff to ICUs? How long does it usually take to train a staff member who previously worked elsewhere?
Thanks very much for the question. So there's a couple aspects of that. We had done some training of staff during wave 1 when we anticipated we would have far more ICU patients than we did. Unfortunately, that's now come to fruition. So we are capitalizing on that training. We also redeploy staff that are have a similar skill set to what you need to be in the ICU, and provide a mentor in real time, and then a team approach to care. So it is relatively quick, given the people that we end up redeploying, but there is some training involved.
Thank you very much, Dr. Dukelow. On to the next question. This is again from Andrew Graham. Dr. Summers, this one is for you. Given the numbers of outbreaks, or the number of outbreaks associated with Western University, are there plans to have staff at Western prioritize to receive the vaccine? Has Western reached out on this matter? If so, how have those conversations gone?
Thanks for that question, Andrew. The Middlesex-London Health Unit continues to follow the prioritization direction that is provided to us by the provincial government. We have to determine the timing of the next group that is available based on the inventory that we have. However, the sequence is determined by the province. When we look at faculty or staff at Western, for the most part, we've actually seen outbreaks amongst students. We have seen very little, if any, transmission from a student to a staff person, particularly in a lecture environment or anything such as that. So again, a majority of those cases associated with the university have been associated with student interactions directly. But as I mentioned, when it comes to vaccination efforts, that guidance is directed and dictated by the province.
Thank you very much. The next question comes to us from Craig Needles with Blackburn News. Dr. Summers, this one is going to be for you as well. With various outlets reporting that the provincial cabinet is closing schools, do you believe it's the right decision? And is a school closure inevitable in Middlesex-London?
Thanks for that question, Craig. Certainly don't have any particular insight into the discussions at the province. However, to say that it was always the objective of our community locally to avoid school closures if at all possible. I think as cases continue to rise, school closures certainly have to be entertained as part and parcel with having more people stay at home. But as I mentioned, they have been stated to be the last thing to close. Hopefully, we will see numbers drop precipitously. That would be great. And if that happens, then yeah, we can avoid school closures, but we will monitor how those numbers evolve over the next week. And certainly I know that our provincial colleagues and leaders and elected officials who have tough decisions to make will be monitoring those numbers closely as well.
Thank you very much. On to the next question. We're going to go to Jennifer Beeman. And actually, we're going to go to, because that's been answered. We're moving down along. Okay, Emily Taylor at the Western Gazette has a question for Dr. Dukelow. Dr. Dukelow, are any of the patients in the ICU in the 18 to 20-year-old age group?
Not at this point in time, Emily.
Okay. Now I've got to find the next question here. Okay. And I think we are just about done. I'm gonna ask one, Dr. Summers. This is from Jennifer Beeman, and we've had a lot of conversation about N6A, and Mayor Holder talked about the conversation about hotspots. Jennifer Beeman is asking, given the recent high % positivity, should N6A be deemed a provincial hotspot?
Thanks for that question, Jen. I would start by saying that the epidemiologic definition of a hotspot is not a definitively defined thing. Certainly within our region, that N6A postal code has been a hotspot. You've heard us reference outbreaks in those areas. You've heard us reference age cohorts that we know spend much time in that area. And as the mayor referenced, we continue to have discussions with the province to highlight areas of concern within our region and our escalating numbers in the hope that we can see as much vaccine as possible in our region. We are always mindful, of course, that there are many places that require vaccine. So do we, and we will continue to have conversations with the province around that. Mr. Mayor, I know that you have some comments on this as well.
Yeah, and thank you, Alex. look, we've talked about some of the steps and process that we intend to take, but there's something that hasn't been said. And I just want to say to the folks that aren't following the rules, stop it. It's been absolutely ridiculous. The best way to handle this issue is to stop the congregating, is to stop the issues around not wearing a mask, to stop the issues about not doing hygiene. I mean, you know, we talk about all of the right things at this level, but sometimes we have to sort out the sinners. And you get to a point where you say enough. And this is where I think at the political level, I'm not here to speak for the warden, but we're frustrated when those who don't follow the rules are the ones that we have to kowtow to because they're ignorant and they do not respect the rules and the health of other people. And so, you know what? We can do all we want in the ICU, and really God bless the teams that handle the work at the hospital and the ICU units, and the health unit can do everything it does. But until people take individual responsibility, none of this means a damn, hotspot or otherwise.
Thank you very much, Mr. Mayor, and I think that is a good place to conclude on this afternoon. Where do you go from there? I think if we had the virtual mic to drop, Mayor Holder, that I think that would have been it. So we will call it there for this afternoon. Thank you for joining us for this virtual media briefing. We will be back on Thursday afternoon at 2 o'clock. And until then, we hope you have a great rest of the day, and we will see you on Thursday. So long for now.